you all for being here today. Obviously, we're saddened about what happened in Las Vegas, but we also want to stress that thoughts and prayers, while they're appropriate, are not enough. We need to take action, because that's what Congress is all about. And we need to get the president involved, and we need to get our colleagues involved to stand up against the gun lobby, which, as you know, for many years has stifled congressional action on gun safety legislation. And hopefully this last murderous action that killed so many and injured so many people will be a call for action to get our colleagues to actually move on important gun safety legislation. But really what I wanted to stress more than anything else is that, you know, the gun lobby, the NRA and others, it's not just the NRA, there are others as well, they try to act as if these mass murders are normal. Like somehow this is part of the, you know, the American spirit or something, that people have to use violence as a means to an end. And that is totally not true. This is not normal. It's not normal to have these mass murders. It's not normal to have so many people individually killed on our streets. You know, whether it's here in the 6th Congressional District, or it's elsewhere in New Jersey or around the country. And if you look at what happens in other developed countries, we have a crisis that doesn't exist. The number of murders that take place in our country are so much greater than any other countries like us. And I think the reason has to do with the fact that we have very little, very loose gun safety laws. Over 100,000 people are shot each year, 33,000 of those fatally. Interestingly enough, which I think you probably know, is that New Jersey has one of the lowest deaths from gun violence, and the reason for that is that our state, for the most part, has good gun safety legislation in place. But obviously, because of you know, small state, it's sandwiched between Philadelphia and New York, because the federal laws are so loose, and the laws are so loose in other states, we continue to have problems with murders and gun violence as well, even though we do have good laws and one of the lowest death rates in the country. So I just wanted to mention some of the things that I would like to have happen, and I'm going to introduce Bonnie Watson Coleman, who is such a leader on this issue from our adjacent district here. And I guess I want to stress that no one thing, no one gun law, you know, I'll mention a list of things that I'd like to see done. No one of these is necessarily going to solve all the problems or obviously eliminate all the murders and injuries from gun violence. But that doesn't mean we shouldn't try to even, you know, even only get a few of them. I think it's going to make a difference. Most importantly, universal background checks, right? We all know that there are a lot of loopholes at gun shows, over the internet, you know, that make it so that many, if not most, of the murders that take place with guns that have not, or perpetrators that have not gone through background checks. So, you know, that's probably the most important thing, and within that context, of course, is that people who are dangerous, you know, like terrorists, for example, should not be able to access guns. They should not be able to buy and be licensed to have a gun. But I also wanted to mention a bunch of other things, and I'll let Bonnie talk about the Stop Online Ammunition Sales Act, because that's where she's been involved with for 7 years. But we also need an assault weapons ban. We need a prohibition, and this comes within my committee, the Energy and Commerce Committee. I was a few months ago over at Robert Wood Johnson Hospital, which isn't far from here, in the trauma unit, and they told me we need data, we need research on gun violence. We have a prohibition on research on gun violence. You cannot get a grant to do research on it because it's prohibited under federal law. That needs to change. That's in our committee, my Energy and Commerce Committee. But the list goes on. Probably the one that has gotten the most attention right now is a bill that was just introduced called the Automatic Gunfire Prevention Act. And this is the one that prevents the sale of these kits that allow you to take a semi-automatic weapon and make it into a fully automatic weapon, which is exactly what happened with the bump stock that Stephen Paddock used in Las Vegas to inflict so much damage. I mean, there's so many other things. I just talked to some of the New Brunswick police. You know, they have a buyback program for guns. We need to do more in that regard as well. But I just want to end, and before I introduce Bonnie, and say once again that I do think right now, you know, we could be wrong, but I do think right now that the atmosphere in Washington is a little different. I think it's not just the fact that so many people were killed and injured in Las Vegas, but it was also the nature of what happened that I think is making some of our Republican colleagues, and even those in Republican leadership in the past, have not been willing to address this, maybe to address some of them. And so we need to take advantage of that sentiment right now to try to get some of this passed. Now, Bonnie, as you know, has been a leader on this, much more so than me. And she's been out there, particularly on this one bill that she's going to talk about. But, you know, you should know that she hasn't been in Congress that long, but already on this and so many other issues, she stood out as a defender of the concerns that the average person has. This is one of the most important things. Thank you.
Thank you.
Thank you for coming to my day.
I feel particularly blessed to be a partner with Frank Pallone and get an opportunity to do things in New Jersey together, because he and I agree on so many of the issues that are important to us. I want to have us think about something for a moment. When Paddock was identified and they found his brother just kept saying he's just a guy. He's just a guy. So he isn't just a guy. He was a guy without a police portfolio. He was a guy without a mental health portfolio. He was a guy that we have no known ideologic alignments, whether it's white supremacists, neo-Nazis, KKK, or Islamist jihadists. He's not any of those. What was he? He was an older, middle class, upper middle class, suburban white man. So he wasn't on anybody's radar. And so we need to recognize that the commonality of all these tragedies isn't always someone that you can peg and put into a category. It was the accessibility of so many guns and so much ammunition. So if this had not happened the other day, next week we would have been discussing the silencer bill that Republicans are advancing, and a bill so that you can carry a gun irrespective of the state that you live in, and that would have usurped state laws, that I think some of which are helping New Jersey to stay safe. Just yesterday, the day before, I was in a 6-hour markup of a $10 billion bill to build a wall in the southwest border of this country. Think about this, $10 billion to build a wall that has no use, no consequences, and no one says it is necessary or will make us any safer. If we had $10 billion invested in research about the devastation of the proliferation of guns and ammunition, we could be saving lives. I have a bill that's been in the hopper a long time. It was a bill that precludes you from purchasing a certain amount of ammunition. And should you try, and you cannot collect, you cannot get it online, you can order it, you can pay for it, but you gotta go to a dealer and show up and show who you are before you can get it. That's not a great bill. That's just something that moves along the pathway of trying to make ammunition less available. I introduced a bill just this day that will create a federal registry. We should have known that this guy had almost 50 guns, that he purchased them in 4 different states. We need a national registry. We need to stop relying upon what we consider to be the safe discussion of sensible legislation that only has to do with background checks. We've been trying that for years now, and Republicans have not allowed us to even hear that bill. We have one of our own was shot on a baseball field while he was practicing for a game between Republicans and Democrats. And the only reason there weren't more injuries and the only reason his life was saved was because there were police there. He was entitled to police detail because he was in leadership. And they had guns and they returned fire. But the guy that had the gun that created the problem in the first place is someone that never, ever, ever should have had guns. So I am telling you that we cannot normalize this behavior. We cannot listen to one more of these situations and go, oh my God, let us stand up, say a prayer, and sit down and do nothing.
Yeah.
Just like the people of this United States of America who are citizens of this government, which is of, by, and for the people, stood up and shut down those terrible health care bills that have been introduced 5 times in Congress. That same will, energy, conviction has got to show up from citizens all around this country, in red districts and blue districts and purple districts and just plain old apathetic districts. Because we, the people of the United States of America, we're the ones that are going to make this change happen.
You're right.
Not us down there in Congress alone. So we need to energize our communities.
Yes.
Not just our communities in these blue districts, but our communities across this country.
Yep.
Because you can't even go to a concert and expect to be safe. You can't walk down your street and expect to be safe. You can't go to the movies and you can't send your children to school. What will it take? I'll tell you what it will take. It will take an outpouring and an accountability from we the people of the United States of America that they've not seen before. And then we'll see a change happen.
Thank you, Bonnie, for saying it so well. Thank you for being here today. Next, tell us what's going on the state level. Another champion for gun safety is Senator Riguccio.
Thank you, Congressman and Congresswoman. These are 2 outstanding members of our congressional delegation, and they're never afraid to speak up, and we're so proud of them to be in Washington. Our opponents say that it's not enough time has passed and that we shouldn't have this discussion yet. But time has passed for us to discuss about Newtown, Connecticut. Time has passed that we can talk about the Pulse nightclub. Time has passed that we could talk about Columbine. Time has passed that we could talk about Virginia Tech. Time has passed that we could talk about Charleston, South Carolina. The question is, when are we going to talk about it? And if not now, it's going to be never. It's ironic that when the Constitution was written, the Second Amendment applied to a gun that shot 1 bullet. And today, it's also ironic that you have to have a really liberal interpretation of the Constitution to say that you can walk around with assault weapons and other guns of mass destruction, that somehow our founding fathers envisioned allowing those weapons in society. So I'm proud of my members of Congress for speaking up. It is time to have that discussion, and it is time to put a stop to this madness. And I hope we all have our collective voices to continue to talk about this and to continue to look for solutions. Thank you.
Thank you. So I have 3 mayors. I'm not going to, 2 of them are going to say a few words. We have Mayor Womack of North Brunswick this year. Thank you for joining us today. And then we have one of my mayors, not just one of my mayors, one of my best mayors, Mayor Gil Mittler from Highland Park. Oh, yes.
this country. That's nearly 5 people an hour. The children of Sandy Hook, the young adults on college campuses, and now these music lovers have perished because of guns. I'm standing here looking at glass windows in a tall building across from me, and all I can think of are the shattered windows in the Mandalay Bay Hotel. It's enough. We are so lucky to have congressional representatives like Congressman Pallone and Congresswoman Bonnie Watson Coleman to represent us down in Washington. But as they said, they can't do it without us. Hundreds of thousands of women and men marched on Washington back in January. We need to do that again. And we're ready to help you do that job for all of us.
Yes. Yes.
Thank you.
Thank you, Mayor. Now, Mayor is always outspoken in getting the council to pass resolutions and generating a lot of grassroots support. So next is from East Brunswick, in Bonnie's district, is the Mayor of East Brunswick, Brad Cohen.
Thank you. I'm just going to echo what was said before and extend our gratitude to our Congress representatives who are truly fighting the fight for us and with us against what I can't believe we're here again, talking about the same issue of gun violence. In my non-political, non-mayor life, I actually walk around with the white coats like you see here. I'm a physician, and what I do on a regular basis is I'm an obstetrician gynecologist. I deliver babies. I bring life into this world, and to see that the same people that could stand up in front of you and tell you how they stand for gun rights are the same people who are looking to take away the right, who defend this right to life. That's a hypocrisy as far as I see it. And our congressmen, our state's kind of moving upstream like trout, going against what seems to be a movement that defends what's so obvious to the rest of us as counterintuitive and puts the rest of the country in peril. I think that it is a grassroots effort that we need to do to get together, just like it's being suggested. And at some point, and I think that point has to be now, we have to stand up for what is right. That, to me, is standing up for life. Standing up for gun control and putting on common sense type of legislation that makes us all safe. So I applaud our Congress people, but we need to start to carry the torch with them. They cannot do it alone. Thank you.
Thank you.
So now we have a few representatives from some of the groups that are here today. I'll start with Karen Cantor from the Brady campaign of Middlesex County.
Horrible massacre in Las Vegas has once again served to highlight the gun epidemic in this country. Tragically, in the past 477 days, there have been 521 mass shootings. And what has happened since the nightmare of Sandy Hook 5 years ago? There have been changes. More than a dozen states have enacted gun legislation, but mostly by loosening the regulations. Wisconsin, for example, got rid of a 48-hour waiting period for handguns. Ohio now allows concealed carry weapons to be brought into daycare facilities and airports. Florida toughened stand your ground laws by making it harder to prosecute gun owners. Regulate bump stock conversion mechanisms? No. Ban them. In what civilized world is that okay? Allow Congress to pass a bill that allows people to carry their concealed weapons in any state? Is it okay to go back to a frontier-type mentality when we didn't have a police department and everyone took protection into their own hands? I was recently at a public health conference in New Jersey where the gun crisis was labeled a national public health epidemic. We need to study this. But the CDC was threatened by a Republican majority Congress which wanted to, and they threatened to cut off funds to the CDC if they studied gun control. The Dickey Amendment was passed, and so, as was mentioned, that has stayed in place, and we don't, and we're not allowed to study. Is that okay? We need to get a better handle on this epidemic. For now, legislation for universal background checks, the rejection of the share bill regarding silencers, opposition to allowing veterans who have been discharged for mental illness to apply for gun permits must be opposed. Demand this. What we need to do, as has been mentioned before, we here are supporters, but you need to call your family, your friends, and they need to mount this opposition, this support for this movement. You need to talk to your families in Kansas, in Nevada, in Texas. You need to talk to your friends and tell them to join the Brady campaign. I'm glad to see Moms Demand Action here. Any of these places, come to rallies. Make sure that we pressure our legislators to make this, to do their job, to protect their citizens, not to make it a more dangerous place. Thank you.
And next, I'd like to have Brett Sabo from Moms Demand Action, and those are the red shirts that are behind us as well.
Like the Congressman said, my name is Brett Sabo. I'm the New Jersey chapter lead for Moms Demand Action. Two things consistently happen after a mass shooting. Everyone offers thoughts and prayers, and gun sales go up. When is the appropriate time to discuss changing gun laws and addressing the public health epidemic that Americans are faced with? Seems like this question is always in the air. After mass shootings, like in Vegas, the opposition says that it's not the appropriate time to mourn, and we pray and we remember the fallen. When a shooter is being put on trial, the opposition says this is not the appropriate time. Let victims and families focus on the trial. When a victim, like Representative Steve Scalise, comes miraculously back into Congress, onto the Congress floor after a 3-month-long recovery that's not even over, onto the Congress floor, the opposition still says this is not the appropriate time. And when some days go by without a high-profile shooting like Las Vegas or Orlando or Arlington or Charleston or Sandy Hook or Aurora, when it's only a typical day, when the usual 93 people that die every day in this country from gun violence, the opposition then says, what gun violence problem? There's nothing to see here. Let's work on something more appropriate. But it's those times when the unheard 93 people die that the gun lobby and the NRA leadership do their worst work. You do not need a permit to conceal carry or open carry a rifle or a handgun in Nevada. You do not need to register your gun in Nevada. You can buy attachments to make your semi-automatic fire like an automatic while still keeping the rifle officially a semi-automatic. In Nevada, Moms Demand Action has successfully pushed an initiative to require background checks for all gun sales, including private sales. In a state with such lax gun laws, a secure background check system is even more important. While it's wonderful that it passed last year, it's been over 10 months and there's been no movement putting that into place. During Sunday's shooting, and even at the Alexandria attack on the Congress members, the first thing eyewitnesses reported was the sound of gunfire. Hearing where it's coming from and knowing to duck and cover can be the difference between life and death. The gun lobby is pushing for legislation that would deregulate silencers for the first time in 80 years. The guise of hearing protection is a distraction from the fact that the gun lobby has seen a downturn in gun sales for the first time in years, and silencers are the largest growing arm for gun manufacturers. Making it easier to buy a silencer from a private seller will only end up with deadlier weapons being used by dangerous people who are not interested in gaming and hunting. There is a reason military use ear protection and not silencers, and it's because they work better. Nevada is a state that has reciprocity, meaning states from the other 29 states that share it can honor each other's concealed carry permits. This by no means is to say that they share requirements to carry those permits. Each state is very different. Some, like Nevada, requires no training. Some states have very strict requirements, like Illinois. But right now, Congress is working on federal concealed carry reciprocity, making every state honor every other's concealed carry permit. New Jersey has the third strongest gun laws in the country. How effective will they be if this passes? So the answer to my original question, when is appropriate time to start talking about gun violence, the answer is now and tomorrow and every day after that people are being taken from their families. We must rescue meaning from these horrific shootings and take action that could save future lives. We are not talking about taking people's guns or abolishing the Second Amendment. The NRA leadership uses that to divide us. The vast majority of gun owners and NRA members know that universal, loophole-free background checks are reasonable. Regulating silencers is reasonable. Banning bump stocks is beyond reasonable. If they believe in states' rights because every state has different terrain and culture, they keep it the way it is, but that's not why they want reciprocity. The gun lobby sells guns to those who want to feel more powerful in their lives. Then they sell more guns to the people who need protection and want to be able to stand and fight against the first group of people they were sold the guns to. First they sell anger, and then they sell fear. Moms Demand Action will be fighting just as hard tomorrow as we did today and yesterday. And while, of course, our thoughts and prayers are with the people in Las Vegas, we will honor them with action and the promise that we are not stopping until this hateful gun culture that is uniquely American and killing our people has stopped. Anything less than fighting as hard as we can, as often as we can, would be an insult to those taken and should be deemed by all of us an inappropriate thing. Thank you very much.
We have two more speakers who are from the healthcare community and, of course, have to deal with the violence and that it inflicts on victims. So I'm going to start with Alan Waller, who is the representative from the New Jersey chapter of the American Academy of Pediatric Physicians. And then after that, we have Ben Evans, who is the president of the New Jersey State Nurses Association. So first is Alan.
Thank you. I want to really applaud Congressman Pallone and Congresswoman Bonnie Watson Coleman for really championing these public health issues and for championing the issues of children. So again, my name is Alan Weller, and I'm the vice president of the New Jersey chapter of the American Academy of Pediatrics. And we think of ourselves. We think of ourselves as an organization that is an advocacy organization for children and the pediatricians that take care of them. And I think what we need to realize and understand here is that gun violence is a public health crisis. It is a public health emergency. Gun violence is the leading cause of death in terms of young adults and a major cause of death in young children. And like any other type of public health crisis, as Americans we come together and we solve these problems. But why is gun violence the exception? it should not be the exception. It is a public health emergency. We need to, as Congressman Pallone had said, we need to fund the CDC in order to do research, because we need to fund violence prevention programs. We need to understand the epidemic of gun violence, and we not only need to get guns out of the hands of perpetrators, but we also need to understand the causes of gun violence and the causes of violence in general, so that we can develop effective violence prevention programs, because it's the violence that's the problem also, and we need to better understand that. So I applaud also Congressman Coleman in really trying to push funding for the CDC. The CDC has been gagged for years now in not being allowed to support gun research and firearm research. This is an important aspect of things. If we all come together now, we can think of all these kids, all these families, all these individuals who've been affected by gun violence, and we can say to them, you know, look, we can't bring you back, but let's see what we can do to help prevent this from happening again, that our kids and young adults can walk on the streets, go to concerts, go to school, and not be afraid of their lives because of violence.
Okay, so next is Ben Evans.
Thank you for inviting me to be with you this afternoon. I'm Ben Evans. I'm president of the New Jersey State Nurses Association. My doctoral degree is in nursing, not mathematics, but I know a little bit about numbers. 372, 58, and 1. 372, the number of homicides in New Jersey last year. 58, the number of people killed this past Sunday in Las Vegas. I did a head count as I was standing here listening to our speakers, and 99% of us standing here would be dead if we were there Sunday. One registered nurse was killed protecting his wife in the gunfire. Physicians and nurses see this in the workplace constantly, in the trauma centers. People are injured, fatally wounded, and nurses and physicians are there to take care of them. We try to treat them holistically. We try to treat them body, mind, and spirit. But when you experience this and you are a survivor, what do you live with for the rest of your life? PTSD? Depressions? Grief? Unresolved grief? These are the hard issues that folks live on with. At the general annual meeting of the New Jersey State Nurses Association in 2016, we passed a resolution calling for an end to the ban on researching gun violence. How do we get to the root cause of something if we don't know if it's due to pathology, extremism, or just lone wolf stuff? If we don't know the roots, we can't get it out. So we continue at the State Nurses Association to advocate for the measures that will help us understand and eradicate gun violence. Thank you.
That's the end of our program. If any of you would like to answer questions, please don't hesitate. The press. Yes.
I understand that that particular shooter was on diazepam, and you might look that up. Apparently that just didn't get out in the media very far, but as a psych nurse, I have understanding of why psych patients are not appropriately treated. Now, most psych patients are not perpetrators. They are victims. But 100% of the perpetrators, there's something wrong. There's something untreated wrong.
Well, I appreciate
And
that.
one of the things is, what can we do to get treatment to psych patients, to people who are unable to get employer-sponsored health care? And what will you do? I want to thank Bonnie Watson Coleman for signing H.R. 676, Medicare for All. And I'd like to ask Frank Pallone to please co-sponsor H.R. 676, Medicare for All. So our sight patients may have treatment. Thank you.
Let me say this. First of all, we've worked very hard in the Affordable Care Act, not only to provide help for psychiatric problems or behavioral health problems as an essential benefit, which is required under the ACA, but also to fund the program. Certainly more needs to be done. There's no question about that. But I do say, and I'm not taking away from what you're saying, but I think that one of the problems that I have is that the Republicans oftentimes dismiss gun safety by saying that, well, all the people that commit these mass murders have mental problems, and that's really the answer. And I'm not saying you're saying that, but I don't want to focus so much on that today, because I don't want to get into this notion that, well, if we have help for people that have behavioral problems, that somehow the mass murders aren't different. I know that's not what you're saying. The focus has to be on the gun safety, because I think Bonnie is right. I think it's very important to notice, and we don't know everything, but every indication is that this person who committed this was just another guy. I mean, we haven't had anything ideologically. All his friends and relatives said they were shocked. There isn't anything. There's no, that would indicate that he wasn't anything but just another guy. And so that's why I think the focus when we talk about these murders and gun violence has to be on the guns and the gun safety measures. But I'm not taking away
And the unlimited amount of ammunition.
Yes. And I'm not taking away from you. All right. I think we're done, but thank you all for being here. We really appreciate it.
Thank you.